Drive Time on RTE Radio 1, sponsored by Zurich. We believe small actions can have great impact. Take a small action today. Speak to a financial broker about a Zurich pension.
The EU's drug regulator has approved the use of Pfizer-BioNTech's COVID-19 vaccine for children between the ages of 5 and 11, opening the way for them to be given a first shot as Europe battles surging infections. The European Medicines Agency decision will now be assessed by our own National Immunisation Advisory Committee before they make their own decision as to whether or not to recommend the vaccine for that age group here in Ireland. But how do people feel about their kids getting the jab? Well, John Cook has been asking parents in Galway.
Yeah, I think it's a good idea. I think kids should be vaccinated. Yeah, I trust that they're making the right decisions, so I would vaccinate based on that.
I think they're too young to be vaccinated. They're only 6, so I think they're too small for that, yeah. They don't have any risk now. If they will have big risk, I will vaccinate them. For now, no. What do you think about vaccinating your kids?
Personally, I would be hoping that they may be able to live without it, to be honest. I was hoping that they might be able to generate their own antibodies and stuff like that as we further along in time, but I don't know.
Some people, I suppose, say it might be about protecting wider society, or do you think there's a case for that?
Well, we are taking the precautions ourselves. We're taking the vaccine, the elderly people, so I'd be hoping that would do its job. Maybe we should not have been so quick to let the country back open, and I don't think children are to blame for it. I don't know the outcomes of the vaccine, how it's going to affect development or anything like that, so I can't say.
I wouldn't be too confident about doing it yet anyway.
I would.
He wants it.
I would do it if I got something.
If you got something for it.
If he got something for it. If they give him sweets or something, he'd do it.
Well, as his mum, what do you think?
I'm still in two minds. I don't know. I've been vaccinated myself, but to have him vaccinated when he's his whole life ahead of him, you don't know what could happen.
I'm a parent and also I work in a school.
Do you feel safe at work at the moment?
Yes, I do, because I'm following the protocol and I'm not in a big class, so I have a small bubble. Vaccines would definitely ease that burden, yes.
If it makes some parents feel safer for their children and their family, that's perfect. But I feel that it shouldn't be made mandatory.
Well, vaccination isn't mandatory, so if your kids are offered a vaccination, will you say no?
I would personally say no. I would be worried about putting injections that basically have ingredients that are still on clinical trial into my children, let alone me.
7, 13 and 17.
So your 13 and your 17-year-old are probably vaccinated already, are they?
No.
They're not?
No. I won't be vaccinating my 7-year-old either. They decided for themselves they didn't want it.
Are you vaccinated yourself?
I am not, no.
And even though COVID is rising again and we've had all these deaths, that you're not worried?
No. I didn't get COVID and I'm taking my vitamins and my exercise and I'm happy enough with that.
So you're against the vaccine?
I am. There's 90-something% done. If it was working, it'd work by now.
I told it to be an awful lot worse if there wasn't that level of vaccination in the country.
I don't know, would I believe that?
I definitely think we should. I mean, I'm a healthcare worker, so I understand actually what vaccines have helped us just to survive through this so far. So I definitely think actually if there is an option for vaccines for children, we should definitely use it.
I'm vaccinated and obviously he isn't, but we both had COVID and he had no symptoms. He was fine. As an adult, I was sick. As a child, he was fine.
Okay.
I understand they'll spread it between each other, but the vaccine, I don't think there's enough known about it to kind of put it on the kids.
Yeah, I'll probably go for it. Yeah, I couldn't say yes now today if someone was handing a vaccine to me. But I prefer them not to get COVID, if that's possible. But they could have had COVID as well, and I have no idea about it, so I don't know what their natural immunity is. It'd be lovely to test them to see, have the immunity to it. I definitely think my husband would be saying straight away, vaccinate, that's it. Across the board.
I leave you to that conversation, so...
And that is John Cook there talking to people in Galway. People, it must be said, who have very mixed views on the possibility or likelihood of vaccinating their younger children. Well, for some expert opinion on all of this, we're joined now on the line by Dr. Anne Moore, who's a vaccine specialist and senior lecturer at the UCC School of Biochemistry. And you're welcome, Anne, to the programme. I suppose, firstly, what do you think of what you heard there?
Yeah, I mean, it is very mixed. And I suppose the hesitancy are genuine parental concerns, and I think that it's important that people inform themselves of both the benefits and potential side effects of this vaccine. But the benefits are very clear for children, even the 5 to 11-year-olds, because I mean it is the virus is spreading widely in children at this stage, and it is a virus that infects the unvaccinated. And the 5 to 11-year-olds at this stage and younger are the children that are where the virus is circulating at this stage.
Yeah, and yet I suppose what you would have heard there from some of the parents in Galway, and I think a lot of other parents would be thinking it, is, the virus is spreading, as you say, very widely in that age group, but we don't see or hear of an awful lot of children getting very sick, or in many cases getting sick at all. So why give them something to prevent a disease that doesn't appear to make them ill?
Well, there are some children who do get quite ill. I mean, if you look at the statistics, in the last 2 weeks, 15 children under the age of 11 have been hospitalised because of COVID. So it's not impossible, it's rare, but, one of the reasons for vaccinating is to induce that immune response so a child will be protected both now and as one of the people said, they have their whole life ahead of them. They will likely be exposed to COVID. So it's better to protect them now and get that immune response generated in their children so that they have a better chance of not being sick in the future, now and in the future.
And on that point then, you heard another parent there wondering if her child has had COVID. She doesn't know, and I think a lot of us are also in that situation where we wonder, if there's been COVID in your child's school, have they had it? Do you think it'd be possible at all for people to find out if their child has had COVID before giving their child the vaccine, or does it matter?
It doesn't matter, and actually a vaccine, after COVID infection, it works equally as well, and there could be some benefits of the vaccine after having a COVID infection. There's no safety risks. There is a benefit of being vaccinated even after COVID. It does boost their immune response even more.
And what would you say then to one of the parents we heard there saying, this is relatively untested, this vaccine. It's still, in some cases, going through clinical trials. They're very young. They have their whole lives ahead of them. That person being worried about the potential long-term side effects that we may not know about yet. What would you say to that?
I mean, on the flip side, there are the long-term risks of their child getting COVID and ending up in hospital or worse. So, it is, predicting into the future what their child's life will be, but they will decrease the risk of getting COVID if they vaccinate their child.
So what are the risks then of getting the vaccine? What are the potential downsides of that?
At the moment, the similar side effects that are seen in adults, which are, local transient effects, sore arm for a day or so, and rarely kind of flu-like effects. And what has been seen so far or reported on is a potential side effect in the 12 to 18-year-olds was this myocarditis, heart inflammation. And that is it's a very, very rare event, but it isn't seen in the 5 to 11-year-olds so far. So it is a very safe vaccine.
So if we were to compare that, the myocarditis then, sorry, can you just explain to us what that is roughly?
So it's a kind of inflammation of the heart tissue, and again that was quite transient, but it is a side effect that does need to be looked at in the adolescents and the teenagers. Okay. But so far that hasn't been seen in the younger kids.
It hasn't. So if you take sort of a spreadsheet and you say on one side you have the benefits, and you're saying the benefits are obviously that you give them immunity against the vaccine, and as you say 15 children have ended up in hospital in the last couple of weeks. So some children can get seriously ill, even though I know the number of children getting COVID is very high. So 15 is still a small number, but it is still a number. So you have that on one side, and on the other side, at the moment we have no evidence of serious illness in children as a result of the vaccine in that age group. Is that right?
Correct. Yeah, that's correct. And I mean, the benefits as well are, infections are screaming around children of that age group at the moment. And, what we saw when we vaccinated adults was that kind of what we were calling the vaccine bonus, that it was decreasing transmission. Now, not for, we know now it doesn't last for longer than 6 months, but potentially we can reduce transmission in schools as well. And that keeps kids in school, and for their mental and social and physical health, preventing those infections, I think, is worth vaccinating children.
You know, it was put to me by somebody who was a medical person recently that vaccines are good for two reasons. One is to prevent serious illness and the other is to prevent transmission, and that in children the vaccine is not needed for either of those things because it won't be transmitted. It doesn't stop transmission of Delta. We know that you can still transmit the virus even if you're vaccinated, and it's not really needed for serious illness is what this person was saying. What do you make of that argument?
Well, it's we don't see a huge amount of serious illness. At the same time, we vaccinate children against other diseases that there is as equal or lower likelihood of them being exposed to. And, that is common practice. So I think, if you can prevent something from happening, it is, I think, a better thing to do.
Of course, the dose level will also be lower to make up for the fact that the children are smaller. Can you tell us a little bit about that?
So it's about a third of the adult dose, and one of the reasons for doing that is that lower dose works really well in children, and they produce immune responses that are equivalent to adults even with that lower dose, and also that allows us to use much less vaccine across that child cohort.
Okay, so we would actually get much more bang for our buck from each vial, effectively.
Exactly.
Okay. So when we do start making this available, it's something that hopefully will be, supply I don't think is an issue anyway, but it certainly wouldn't be an issue. Are there any children or any humans, I suppose, with particular conditions, any children with particular conditions that shouldn't consider it? Are there any exceptions to this that we know of, Anne?
That's a good question. I'm not sure that there are. Children with most conditions, medical conditions, would probably be encouraged to get it, but I'm not sure about that.
Okay. While we have you there, I want to ask you about masks, if that's all right, because we're discussing that as well. And I know NPHET are considering whether or not to recommend mask wearing in schools for this age group as well. Firstly, your thoughts on that?
I think we need to use every public health measure that we can that will reduce infection in any way that we can, and that includes masks. One of the things is that the Delta variant is more infectious in children as well, which is different to last year when the previous variant, children weren't as infected, they didn't spread it as much. But with this Delta variant, it is children are more infectious, they're getting more infected, and they're passing it on more than we've seen before. So masks, I think, are one of those public health measures that we do need to implement.
And we were discussing this earlier, and lots of people getting in touch about the hygiene of it. If a mask, or if a child sneezes, for example, behind a mask, and we know how messy a child's sneeze can become, or if there's runny noses, or if they're handling the mask in a certain way, that it could become like the least hygienic product that they're wearing on their body. Would you have concerns about that for small children?
I guess, but if a child is sneezing without a mask and it's spraying everywhere else, that's less hygienic than asking that child to then discard the mask and put on a clean one. So it is containing all that loveliness that's in a sneeze in a mask.
Okay. And then get a new one, basically. So I know we had a texter actually talking about having a box of masks in the classroom so children could get new ones if they needed it.
Yeah.
I'm going to bring you back to the vaccines for a minute, if you don't mind, because a couple of people getting in touch in relation to it. And an interesting question here from a listener. They're saying, don't children need to build up their own immune systems, especially against an illness that doesn't pose as much of a detrimental risk to children? This person says they won't be vaccinating their 5-year-old, but just on that general idea that if we vaccinate them against COVID, we don't give them a chance to build up a natural immunity against it, when maybe at this age group this is the perfect time for them to build up natural immunity when they're not at very, very serious risk of illness.
A vaccine is inducing an immune response that will protect. And we know that from the vaccines that are used across every other age group for COVID-19. So you are, natural immunity or natural infection and immunity that's built up that way, you're still putting the child at risk of more of, disease and symptoms. And yes, it is a lower risk compared to adults. But at the same time, a vaccine, is doing pretty much the same thing without having those symptoms.
Would it have made a big difference, do you think, Anne, if this had all happened a bit sooner before the winter and the winter months and this last wave, that if all the children were vaccinated, or a lot more of them were vaccinated in this age group as well, would that have stopped this current wave, do you think, that we're in? Or would it have vastly reduced it?
It might have had an impact, but at the same time, they are the 0 to 11-year-olds are the cohort that are really kind of harbouring the virus at this stage. It is getting into people who are unvaccinated. So yes, there is an argument to be made that it would have decreased the amount that is in the community at the moment. At the same time, we do have to do this in some sort of a rigorous manner and make sure that the vaccine is safe and does what we need it to do before it is widely deployed in that cohort.
Okay. And then just on the masks, before I let you go, if we do introduce masks for children, would I be right in suggesting that we wouldn't, if that age group get vaccinated, that wouldn't allow us to take the masks off children again, because they'd still be able to transmit the virus? So if the masks come in, they're likely to be in to stay for the foreseeable, aren't they?
I would think so. Yeah.
Okay.
Yeah. Similar to adults.
Okay, listen, really interesting and really informative. No doubt we'll be coming back to this issue over the next couple of weeks. But thank you very much for joining us this evening. That's Dr. Anne Moore, who's a vaccine specialist and also senior lecturer at the UCC School of Biochemistry. We'll take a break.